In this video I'm going to talk about recurrent ankle sprains, or what to do if you keep spraining your ankle again and again. It's also sometimes known as chronic lateral ankle instability or chronic ankle instability. My name's Steph and I'm one of the physios at sportsinjuryphysio.com, where you can get an online assessment of your injury and a personalised rehab plan to try and get you better and back to sport. Ankle injuries are one of the most common musculoskeletal sports injuries that you can get. And I think because they're so common, people don't really take them as seriously as maybe they should, and probably don't rehab them to the right level before they go back to playing, and hence why the injury can either happen again or the ankle can still give them problems. Injury to your ankle is actually a tear to usually one of the ligaments. It can be a partial tear or a full tear. Your ligaments hold your ankle joint together. So if you tear them, then you are actually causing that joint to be, even temporarily, if not a bit longer, unstable. So if you don't treat everything properly, then it's not going to be as good as it should be. If you tore ligaments in a different joint, for instance your knee, most people would take that more seriously and think, oh gosh, you must get that better before you go back to playing. And really the same thing should be said about your ankle. Now, we're going to talk in this video about the sorts of things that might need rehabbing from an ankle perspective after you've injured it. And the sorts of things that we physios will look at. We see this thing all the time, and these are the things that need to be addressed if you want to get your ankle back to as good as it can be after an injury. The first thing you might want to consider after you've injured your ankle and you've gone through that acute soft tissue management like I've talked about in a previous video, you might want to think, are you still getting swelling? If there's still swelling there, firstly, it can affect the sensory motor control of the muscles around your ankle, and it can affect your balance and things like that. And secondly, that thickened area of swelling, if you still go back to playing or running or things that it is not ready for or can't cope with, you tend to get some pinching at the top front of your ankle called impingement, and that can take longer to go away. So if you've still got swelling there, best thing is to say, actually, is it really ready to be going back to all the things you want to be doing, or does it need a little bit longer to just settle down? Ankle range of movement is something that's also important. So after a sprain, sometimes it can be a bit stiff in dorsiflexion, which is this range of movement. Is easily tested in this sort of test, or knee to wall test. You can compare it to your other side and see if there's much difference. Quite often after a sprain, this will be stiff and needs some work to get it better so that your biomechanics are right. And also, this is the sort of movement where if you do have some swelling still, you can get some pinching in this area. So you do have to watch out for if you don't have your full range of movement back. Ankle strength is also important, because if your ankle isn't as strong as it used to be, then sometimes you might have problems where you're not as springy as you used to be. Perhaps on one foot you're nice and springy, and the other one where you injured your ankle, it's all flat-footed, which obviously affects your ability to run quickly. So you need to not only make sure that your ankle strength is good in all directions. This is when you might also need to do some band work, perhaps getting your foot to come outwards against the band, although eventually, if you're going to get back to sport, you need to do some strength work that also involves jumping up and down. There's also been some research to show that hip strength, or strength around your hip and your core, can make a difference for people who tend to sprain their ankles again and again. Mainly because if you don't have very good hip control, then your biomechanics might not be as good as someone who's nice and steady in their core and around their glutes. Static balance is nice and easy to test. Sometimes when you sprain your ankle, you disrupt all the sensory receptors in your ligaments and around the soft tissue that tell your brain what your ankle is doing and help you to balance. So if you test yourself standing on one leg with your eyes shut and compare it to how well you can stand on one leg on the other foot, sometimes people will find that actually their balance is not quite as good. And that's another reason that sometimes people will sprain their ankle again, because they haven't rehabbed their static balance. However, when you're playing sport, you're not just staying still, so you also have to look at what we call dynamic balance. So that's balance when you're moving, so it might be reaching in different directions while you're maintaining your balance, or it might be something more dynamic, like can you hop and stick, sideways, forwards and backwards. That's the next level of balance type exercises that you need to be able to do to try and reduce your risk of your ankle spraining again. How quickly your ankle muscles can react to unstable surfaces, or things like if you were to go onto uneven ground, can be a good test to see how it can cope with the sort of mechanism that might injure it and how quickly your muscles can stop it happening. The way that you walk or the way that you run can also tell us some things about your ankle. Sometimes people don't push off the way they should and the way they do on their other leg. And that can show that you need more strength around your ankle. Or sometimes it's something when you're running that actually predisposes you biomechanically to perhaps going over your ankle, and that sort of feeds into that hip and glute and core strength that I was talking about earlier. So as you can see, there's lots of reasons why you might have areas of weakness that need working on, or areas of balance that need improving, that would predispose you to recurring ankle sprain. And if you've done all of this rehab, then you might want to consider options. But if you haven't done any of this rehab to the very top level that you need it, and that depends on what physical activity that you are trying to get back to doing, then I suggest you would do a programme first for at least 3 to 6 months to try and get it as good as you can get it, before you think about whether or not you need any scans or any orthopaedic opinions and things like that. Now, if you need some help with that, that's the sort of thing we do all the time. So take a look at our website. If you want an individual assessment, then please do book in and we'll have a good look at you and work out a way that we can get your ankle as strong as it can be.